our behavior. So as developmental delays, PFAS can also cause behavioral changes later on in life. So it can have really long-term impacts for kids. One of the challenges we have when we're talking to community about PFAS is just that it can be really overwhelming. Most of us have PFAS in our bodies. They have done some studies here in Seattle looking at breast milk for women, and they have found PFAS in the majority of women's bodies. And we're seeing that across the US. So it can feel really, really overwhelming, but we encourage families to think as a cup that they're filling all the time. And really, that even making small changes can process the PFAS and release them from our bodies and lower the risk that we will have some of these negative health impacts from the chemicals. And it's very similar to lead. We know that lead is in a lot of products. We know that it's in homes. No one is perfect and we can't avoid them entirely, but there's a lot we can do to lower our exposure risks. So let's talk about that a little bit. So reducing our exposures, one of the big things to look for when you're purchasing new products to help avoid PFAS is for labels that talk about it being waterproof, grease-proof, stain-proof, or non-stick, and trying to avoid those products as much as possible. There are also some logos you can look for, like the Safer Choice logo, which is put out by the EPA, and that's specifically for cleaning products. And any product that has that label is not going to contain PFAS. So if you're in the store and you're comparing two different dish soaps or two different carpet cleaners and you see the Safer Choice logo, by choosing that logo, you know your product won't have PFAS. And again, looking for things that are talking about whether or not they're PFAS free or fluorine free, and avoiding those kind of common terms that would clue you in that there might be PFAS in there, that there's water or stain resistant, non-stick, or grease resistant. And we've seen, because this has been such a popular issue in Washington this past few years, we have started to see some brands and retailers committed to removing PFAS from their products. So you can Google online. There's an organization, Toxic Free Future, that does a lot of work with encouraging retailers to change their products. But for example, folks are moving away from using PFAS on raincoats and instead using more traditional wax coating, which is all natural and doesn't have any health impacts, but it still is water resistant. So hopefully, our goal is that us as individuals, as parents, as members of our community, don't have to be constantly thinking about what we're buying, but eventually the retailers and the folks who are selling items are taking this on themselves and selling products that are not going to cause negative health impacts. A couple of other things, besides just buying new things that you can do at home. One of the major ways that PFAS get into our bodies is eating food that contains PFAS. It can leach from the plastic. So if you're storing your food in a plastic container, making sure not to reheat the food in that plastic container, putting it into ceramics or glass so that you're not pulling the PFAS out of the plastic and then eating the food that contains the PFAS. And PFAS also will get into the air and into our dust around our home. So just keeping our windows open occasionally and vacuuming multiple times a week is another way to lower our exposure. And here's just another example. Cast iron is one of the safest cooking pots for everything from lead to PFAS. And they also are something that can last a really long time. So if you're able to replace nonstick pans that you may have with cast iron, stainless steel is another good option. Those are ways to reduce your exposure. And this is an example. I mentioned Afghan Health Initiative earlier. Afghan Health Initiative, they were doing a large project with one of our partners, Hazardous Waste Management, around PFAS in fabric protectors. And their community has these beautiful traditional sofas that they purchase. And they were uh, using a ton of fabric protectors to try and keep them as nice as possible and make sure over time that they weren't degrading. So Afghan Health Initiative has been doing some educational work with their community members about PFAS and trying to encourage them to move away from using those fabric protectors as much as possible. And this is one of their staff members. And then another group that's really interested in PFAS is the fishing community. Um, This is one of our partners, Noe, who works with the Fun to Catch Toxic to Eat program and worked, I think it was the state who did some monitoring of PFAS and fish around the area. We do unfortunately know that there are PFAS in the Duwamish River, as well as in some of the local lakes where folks are fishing. So multiple agencies are working to try and create guidance for folks who are interested in fishing. So you can go online to the Washington State Department of Health and look up where fish may be contaminated, what types of fish to avoid, and how much is safe to eat versus what may be enough to cause health impacts. So there's a lot happening in our area and there's still a lot of work to do. But by gathering this information, we're showing folks that there is a real issue happening here and there is a real impact on the people who live here because we can't even access the waterways without being exposed to these chemicals.
Um, I will also allow everybody to, if you have any question, you can raise your hand or you can just write it on the chat box, and we'll be able to ask, Ashley, in regards, those questions. But I have someone, from outside was just texting me. You mentioned something about the water bottle. So when you said about the water bottle, can you define about also like you can say your question in English and then you can also say that in your native language, because I know that some of your people are tuned in. In Tonga, ko hana ye me o fika aki mo me akan hange ka fo hina vai pe ko hai ai kemikale o ko ka ki sai ai ki o tausino. Okay, Ashley, about the water bottle, if you can describe more, and is there any chemicals that come out from the water bottle?
Yeah, so with water bottles, they use PFAS sometimes to line the inside to keep them from degrading over time, so to keep them uh, stronger. And so we know over time that PFAS does get into the water. Unfortunately, I don't know. They don't have to label the water bottles. So one thing to just, if you want to, if you're drinking out of water bottles regularly, an important thing is to keep them out of direct sunlight or heat, because that's one way that those chemicals are released at a higher rate. And also, if it's a water bottle that you're reusing, you know, not keeping the water in there longer than 1 day, before you put new water in, because that will, the longer it's in there, the more chemicals are going to be released into it.
So in
And if
other
you keep,
words, it's not safe to drink the water bottle.
say that one more time.
It's not really safe to drink those water bottle.
I don't know off the top of my head how much PFAS is leaching into the water, but we do know that some water bottles do contain PFAS. So
Okay.
I would just avoid, like I said, anything that's been sitting out in the heat or has been sitting out, in your car for longer than a day. I would put new water in it.
Okay.
Um, I don't know off the top of my head. I don't think there's been much research on how much PFAS is getting into the water from bottles, but we do know that they use them in producing them in the plastic bottles.
Thank
And
you so
that's
much. I think you did answer it and it's very clear. But I have someone. Oh, they just hang up. They were calling in to ask a question. Maybe they will call again. Um, yeah, it just my from my own question, like having all these chemicals. What are some of the um, what are some of the these chronic disease that maybe the PFAS can create?
Mhm. Let me pull up my slide. Mm. So we know that PFAS can impact our immune system. One of the things that we see with children, for example, is that PFAS can make vaccines less effective. There's still a lot of research to be done on that. I think it's something that's still kind of evolving. The other one is cancer is really the major one that we've seen strong evidence for. So being exposed to high levels of PFAS can cause prostate, kidney, and testicular cancer. Also developmental delays like low birth weight. Again, that abnormal puberty because it impacts our hormones and behavioral changes in young children. It's also believed that it can reduce fertility, so your ability to get pregnant, and then can cause complications for folks who are pregnant, like high blood pressure. And then the metabolic piece, it can cause high cholesterol and higher risk of obesity and hormonal changes. So that puberty piece, but also um, it can, in adults, there are also hormonal issues that can come up for folks.
Oh, I think
And
that
again, there's
yeah,
Mhm.
the person that was asking about the water bottle, she just texting, thank you so much, Ashley, for answering my question about the water bottle. But if I don't drink the water bottle, what is another safe way to drink the water?
Yeah, well, purchasing like stainless steel water bottles instead, like something that's not made of plastic. I don't know, like I don't know about every type, but you could look up online if you wanted to buy a reusable plastic water bottle and look to see if the manufacturer talks about PFAS. Because we are starting to see that it's enough of an issue that people will put online that their products are PFAS free. And that's what you would want to look for. So, kind of like on this slide, looking for labels that say they're PFC or PFAS free or fluorine free, and using those types. But metal ones, for example, are definitely are going to be PFAS free as long as they don't have any strange linings. Um, so that would be one strategy. And I think again with PFAS, when you're thinking about your exposure, there's many different ways that we all are exposed to things throughout our day. It's really unavoidable. So we're not trying to cause folks to panic and feel like I can never drink water out of a water bottle again, but just really thinking about simple ways that we can lower our exposure. So for this person, being aware if the water's been sitting out for a long time, keeping it out of the heat, maybe buying a steel water bottle that they can reuse. All of those actions will help lower their exposures. So it's all about small changes and trying to also push for bigger changes here in Washington State so we don't have to think about it.
Okay, thank you. Um, I'm gonna pass on, the mic to the different speakers, like they're representing their community. I'm gonna ask Lowell Elick from the Marshallese community. Lowell, this
Yes,
topic here is applicable to everybody, especially the coming up holiday. Go ahead, Lowell.
thank you, Sylvia, and thank you, Ashley, for sharing this very important topic. I think my concern is, and what we can take from here is, this also can affect our children because it also has products that are used in dental products like flosses, and in the Marshall Islands, we've dealt with a lot of issues that we um, uh, I can say we've had issues related to a lot of chemical issues. One of the issues we look at are mercury in our fishes, in the tuna. But now looking at this PFAS, and now doctors telling our children to floss every day, use these certain toothpaste, and putting, using these brushes, and everything have these chemicals that can be a harm to our children, and using them uh, for a long time, and then knowing that you grow up, and then sometimes you're like, the kid was very healthy, they were athletes, and then how did they get that cancer? How did this person become sick? And now we know why some of these effects are happening to people that were very healthy, is because the chemicals that are put out into the world by people that created them. So yeah, thank you. And I think we should all really educate each other and raise more awareness about these chemicals that are affecting us, especially us islanders and Pacific Islanders here in the mainland, because we use a lot of these products, especially when we see them, that some of them are very cheap. We see them at the dollar store, like, oh, I'll just use this, and because it's cheaper. Like some of the foam products and the paper products, we use them at our parties. We do a lot of gatherings and funerals, birthday parties, and a lot of these products we do use. And I think we should really raise awareness about these products that can really affect our bodies, and the effects that um, happen to us, especially the health effects, like how cholesterol issues. Um, Cholesterol is something that we islanders have with us, and so I think hopefully this is not one of the things that contribute to our health, cholesterol issues. But yeah, thank you. And I can take some of the what I've learned today, and see if I can also add it to our program and our activities, and see if we can yeah, integrate it to some of our activities. But thank you, and thank you for being here. And I thank you, Sylvia, and your team for bringing Ashley to be a part of this forum. Modada.
Thank you. Thank you, Lowell, for joining us. And now we're switching the mic to Alatalo. Alatalo? Have anything to share about the chemicals? Because all this information we are going to share in our native language to the community.
It's really eye-opening to listen to the presentation today. As a Pacific Islander, I've just learned something like do not reheat food in plastic containers that when you go out and you eat, then you bring the food home, you still store it in that same container, put it in the fridge. When you're hungry, pull it out of the fridge and reheat it in the same container. Well, I've just learned something new today. Like, this is really why we're having these conversations and this sharing, so that we can learn new knowledge and then pass it down to our community. So that's something that stood out for me. Everywhere is chemicals. There's chemicals everywhere. But if we just have a little bit of knowledge to avoid, and then also like practice, safe, when you get your container, store your food in either a glass container or transfer your food and onto a plate and then reheat it that way. So thank you so much, Ashley, for this knowledge. Greatly appreciated. Thanks, Sylvia.
Thank you, Alatalo. Okay, I'm going to switch the mic to Lydia from the islands of Fiji. Lydia?
Can you hear me, ma'am?
Yes.
Okay. Thank you for this topic. Since what you've mentioned, Ashley, that most of these items are connected to high risks of having cancer. Since the finding of this, has been there anything done to minimize the producing and the manufacturers of these items? That's my question. Because it is, of course, present in every household.
Yes, it is a great question. And it's, I will share, in Washington State, we do have a program that's called Safer Products for Washington that the Washington State Department of Ecology runs. And they have been pushing bans on PFAS in certain types of products. So I believe in 2025, a number of bans are coming into place, including the bans of PFAS in waterproof mascara, paper takeout containers, so those food containers that are, like the boxes, and carpet and stain resistant sprays. So that's just one example where Washington State is really leading on trying to put pressure on companies to not use these chemicals anymore. And we've also seen some companies do this on their own. Like I mentioned, some outdoor gear companies have started using wax instead of PFAS on their rain gear and trying to remove those products from their shelves. So there is work being done, but there's a lot more that needs to be done as well, because really, it is very hard to hold companies to, the harm that happened downstream from their products. So our voices and hearing from people is really important, and connecting people with this work.
See, for example, like today, most of us just came to know about it from the info that wasn't there in our mind long time ago without our knowledge. Now we came to know. From my side, I think the awareness is not that strong to go out, and we need to do something about it, because we, the Pacific Islanders, most of these items, we use it. Yeah.
Yeah, I completely agree. It really is not something that is well known really in most communities. And it's only been in the last few years that it's started to get attention for the health impacts. So I completely agree. And with public health, this comic book is just one example, but there is a lot of work being done across the different departments in King County to try and raise awareness, and work being done at the state to try and put in bans in place. But there's absolutely a lot of work to be done to get people access to this information.
And hopefully masks and gloves are not part of it.
Like masks, the COVID masks and gloves?
Yeah, whatever mask that can be connected to that.
I am not sure. I can definitely ask our toxicologist. I haven't heard of anything, but I'd have to do research on that.
Thank you, ma'am. Thank you.
Okay. Thank you, Lydia. I'm gonna give the chance to leader of the senior community. She works, with elderly, 50 and above. And I think the oldest one is about 85th. So I'll give the chance, to the coordinator and the leader, Sina Aloitafuna. Hi, Sina. Is inside? Oh, okay. I'll give the switch over to Pastor Azeri.
Hello. Sorry, Ashley. Just just a question. Like, you know, when we eat the water, we drink water, and sometimes you never drink the water, the whole a bottle, and you leave it. Is there risk? I mean, like when you come back and drink that later on, since it's because it's something that we do often, and kind of like we never know what's in it. So I'm just trying to see that if that's something that we need to avoid or something that is, that we still can go with it.
Yeah. Yeah, I mean, these are all things that I do myself, and I know we talked about the plastic food too. I mean, I'm definitely guilty of also reheating things in plastic. I think the heating is the biggest concern. So again, keeping water bottles out, if you leave it in your car and it's hot or it's sitting in the sun, that's where it's going to really leach a lot of chemicals. So for sure, if you know it's been hot and sitting for a long time, I would definitely not drink it. I would avoid drinking it. Um, I think for just generally sitting on a shelf, I can't really say how much PFAS is leaching into it. But I would avoid anything that's been sitting out in the sun in the heat for long periods of time as much as possible. And again, like if you can get like a stainless steel water bottle or something like that that's reusable, that's not plastic, that's an even better option to lower your risk of exposure.
Okay. Okay. Thank you.
Yeah.
Thank you, Ashley. Appreciate it.
Yeah. And I'm sorry, it's so hard with these things. It's never a perfect answer, because it's so complicated. But the more we can lower our risk, the better.
Yeah, I think what you're doing right now is getting us informed with what we need to know. It's very helpful, especially when we are introduced to something that we do kind of like we are familiar and we are just used to taking it, and it seems like we are careful with how we do that. And to our advantage, I think it's a very useful information that we can share with our people.
Okay, so each person, if we also, like when you ask your question, you can maybe say something in your native language, so that your community could understand and follow up with that. I think it was like Sina Aloida Funa Pecker. She's saying, what do you recommend type of water bottles to drink? Glass or plastic bottles?
Glass is a great option. Glass or stainless steel. So I have my steel water bottle that I use, are always going to be healthier than plastics just because the plastics do release those chemicals over time.
Right. Yeah, I do have a can water in my sink, that adjusts to my sink. And I can tell sometimes, when I drink it, it's a lot different, than after you're drinking from a plastic bottle. Sometimes it feels better, like if it's a glass bottle, water from Ireland, But thank you. I think I have someone on the line. Hello? Malolele? Oh, always missing that person. Yeah, please, everybody that are on, if you could go ahead and share, the link, to all your friends on Facebook and also YouTube. Let everybody know, this is one of the top topic discussions, because it's very, very necessary. Okay, and I have another question. How can you know when you are exposed to the PFAS?
So currently there aren't any tests that are offered to see, if you have PFAS in your blood. We do know that most Americans do have some level of PFAS. So, and there isn't really a treatment. It's not like, the flu or an infection where you can take antibiotics or anything like that. So really the main thing to focus on is lowering that exposure risk and thinking about what are simple things that you can do to kind of lower how much you're being exposed to on a day-to-day basis. And we're still learning a lot about PFAS, and we're learning a lot about how to remove them from the environment in the first place. We know that they're really hard to break down. So I think this will be a changing topic over the next few years as we learn more.
Okay. Thank you so much. Just feel free to write down, if you have any questions, in the chat box. That would be much quicker for us, to see that. There's just another question that just came. Like when you have, spraying any perfume, like, what is a better way? Do you think that is chemicals if you just get your cologne and spray it around, or it's better to spray it on your clothes? Or tell us about, if that's part of chemicals.
I'm not as familiar with perfumes and colognes as far as what chemicals to look for. I think anytime you're spraying anything, it's going to be, really tiny particles in the air that you're breathing in. So any chemicals that are in the product are going to get into your body much quicker. So for PFAS, the sprays that we talk about a lot are the cleaning sprays, the carpet cleaning sprays, and trying to avoid those as much as possible. And if you can't avoid them, when you are spraying them, making sure you're opening your windows, doing it outside if you can,
Right.
Vacuuming afterwards to remove any of the chemicals that may release into the dust. But really, yeah, anytime you're spraying anything, whatever chemicals are in that product are going to get into your body directly through your lungs at a quicker rate than they would if you were touching it. Yeah, I'm not sure about PFAS and perfumes and cologne, but it is really important to think about anything you're spraying in your home and keeping your windows open when you're doing that.
Thank you so much, for that. Yeah, a lot of times, you wonder when you spray anything, if you breathe in, is that healthy or not? Okay, here is another question that coming from Gina. She said, about like when you were talking about like the waterproof. What about if it's a jacket, that you wear? Is that bad, or it's affect your skin, or how can you consume chemicals from that?
Yeah, so with waterproof gear, a lot of them do contain PFAS. And what happens is that over time, the chemicals start to break down. And, sometimes they sell aftermarket sprays or washes that you can put on that would put more PFAS onto the product to keep it waterproof for longer. And those are really that's when you're going to be exposed. It's not necessarily that it's going to leach into your skin, but you have it in your home. It's breaking down over time. It's getting into the dust in your home and you're breathing it in. And that's going to be the exposure source. Or you're treating it with a new spray and you're spraying it in the air and breathing it in. And you're starting that cycle over again. So for me, I mean, I have rain jackets. They probably do have PFAS. At some point, I plan to replace them with versions that don't. But I think about vacuuming, so that dust piece is where the exposure is coming from. As long as you're vacuuming regularly and removing the dust in your home, you're opening your windows, that's going to lower your exposure source. So I wouldn't go out and just throw away all your rain jackets, but I would think about it as a multi-step process that, next time you go and buy them, because they're expensive, you're thinking about what products you're bringing into your house. I wouldn't put new water resistant spray on them because that's just basically a direct spray of PFAS. And I would just keep them, in a closet and make sure that you're vacuuming often. And by doing all those steps, you're really lowering your risk of exposure a lot.
Thank you. You know, you explain a lot of the things, you know, that dealing with us, you know, on a daily life, you know. And I think this is very, very relevant. It's an educational, also a wisdom, it's a knowledge for our Pacific Islanders. Right, Alatalo, also Lupe Talamoni, Lowell Alik, also Pastor Aseri, and Sina Pekka. Thank you, Lasike, for joining us. And then also varieties, you know, of other listeners, you know, that tuning in. Latu Huakau and also Tessa. So we're coming over to close to the end, but we can have 10 minutes, you know, after 3 because we started a little bit late. I'll let you guys, you know, ask if you have any other question. Lupe Talamoni, I know you're dealing with a lot of different organizations. You're a navigator. You're also working with the APCC, you're working with elderly. What is something that you learned, you know, or something that you think that would be to ask, you know, to make it safer when you're working with the community? Lupe?
Thank you, Sylvia. Well, I guess that name really suited for the PFAS, Forever Chemicals. But I wanted to say thank you, Ms. Ashley, for bringing this into attention for the community. I know I shared a question on our chat because of the fact is that every day that we're using chemicals, plastics, we name it. I myself is an asthmatic victim, but what we're going through with elders is the same thing with us that has a chronic disease, and a very that we need to aware of for our surroundings, especially for our intakes. So, can we have? Is there a way that you can share us in the future for a statistically measurement that proven and be evident that our community will be aware of that there's an enemy of us that's so-called forever chemicals that we need to be working together as a unity community to share, to help each other how to utilize plastic safely for our different generations that are gap of educating through this. And even though I'm so thrilled and pleased for Miss Sylvia sharing this on VOC CS platform to teach our people. And then I was just having different texting coming in, and I'm trying to answer. That's why I couldn't answer it, but I put it on there in the chat so that you could have a little basin to it. Ya fa malulu atu finangalo ya na mo mai tato text. Wa lo tango tu fesiri ile ngana fa Britania ina ia mafai ina tali atu ya Miss Ashley ile fesiri ala o le tali atu fa malulu atu ya fa fongani I said how stay me tato talanola ia mo le ngana Samoa. Sorry, Miss Sylvia, I just informed I have more than 20 people that's texting me about they felt. So I put it in a question and I mentioned to them that Ms. Ashley would ever input it or when she shared in the future, and I will share with them as well. With all my respect, and thank you again.
Thank you so much, Lupe. Thank you for sharing. And, you know, alofa atu. Tēnei Samoa. Thank you. I really learned a lot, you know, too. And I wish that we could have this topic maybe, you know, once a month or once every other month, you know, because this is something very important that learning us. We don't even know that the chemicals is right in our plate. We don't even know that the chemicals is right in our clothes, the fabric, you know, the water. I just have a question here from Nia Kunawave. Nia, I think this is the wife of Pastor Asheri. How do PFAS contaminants typically enter the water sources, such as groundwater or surface water? Thank you, Nia.
It's a great question.
Of Fiji.
One of the major ways that it gets into groundwater is that we've seen so far, and again, this is still really evolving, which Lupe's question about PFAS levels and what would be a dangerous level of PFAS is something we're really still learning about. with water sources, where we see large amounts of it is near factories that are producing PFAS. So that happened in North Carolina. There was a river that was used for drinking water that a factory was close to, and it got into the water system. Here in Washington, we had an incident where PFAS got into private well water because the folks were living near to a military base where they were using firefighting foam that contained PFAS. Here in King County, we're very lucky. We have started doing, and I can find the link, they have started doing testing across the county of all of our water systems to look for PFAS. And we haven't had any major incidences where they found it in our drinking water. There have been some smaller concerning levels that they've been able to address to make sure that people are not continuing to be exposed. But I can share that with Sylvia so that you can look online and look at where your actual water is coming from and see if it's been tested or not for PFAS. And in King County, one of the major concerns was, firefighting foam used in places like the airport, and they've committed entirely to removing PFAS from their use. So they no longer use that on their properties. So there's much lower risk of PFAS from something like that. But it's usually these bigger operations like firefighting, military bases, or these factories where they're producing PFAS, where it's getting into our water systems.
Thank you so much. I hope Nia Kunawabe, please spread out, to the Fijian community. Aussie said thank you. Nia Kunawabe, could you say something in Fiji? Do you know what she explained? Just like 1 minute, I'll give it to you. Oh, I see. I'm sorry. Okay, Nia, I'm glad you get it. Please always share. The purpose of having this program, that we are the leaders, that we need to spread it out to our community, help them, save them, and also teach them, educate them, with this great information. I really think that this is one of the top topic that we need to be aware, that we don't even know that every day, even getting on my car, it's just like you're riding, it's just like chemicals are everywhere. Chemicals are in the air. Chemicals are just like right next to you or right in front of you. So this is kind of to help us, to live in a healthier life. Okay, last but not least, I wanted to, this person here, to keep coming on and off, John Wonder Little, was asking to if you breathe in any heater that put in like with the like a fire, is it chemicals or is it bad? Because we have that like in a grandma's house. It's one of those old one, and she still have that, but she passed. But I'm asking, how safe is that, or we need to eliminate it?
I'm not super familiar with fireplaces. I know,
Still with
you
the
definitely
woods.
want to make sure that you're, sorry, go ahead.
It's with the woods. It's with the woods, and it smokes, coming out of it. For the breathing,
So it's like an open, like a fireplace with wood smoke, not a gas fireplace.
Yes, exactly.
Anytime you're breathing in smoke, it's not going to be great. But as long as you're avoiding wood that's not treated, you wouldn't want to pull wood that's been stained or has any sort of water, like varnish or anything like that on it. That would definitely have chemicals that we'd be concerned about. And then making sure that your fireplace is pulling the air properly so that it's not dumping smoke into the house. That would be another concern. But I think, wood fires, fireplaces have been in homes for a long time. I have one myself, and as long as you're taking the proper precautions to make sure that your flume is working and that it's pulling the smoke properly, I don't think it would be a major concern for chemical exposures. And then avoiding any wood that's like treated.
Okay, all right. Thank you. And now it's about like 6 minutes after 3. I have 2 more and then we'll wrap up, Alatalo, I'll give you the final opportunity because I know you do work with the public health, with the, Pacific Islanders Health Board, BI Health Board. And I know you always have a lot of events, and trying to help our communities in a healthy lifestyle. Go ahead, Ala.
It's really great to hear this subject on chemicals that's really affecting our communities, especially underserved community like Pacific Islanders. So at Pacific Islander Health Board, we are tailored into spreading awareness as well as offering resources to making sure our community is healthy. We also have a grant and an opportunity for us to spread awareness about environmental justice with the HEAL Act. So these are aligned in all the programs that the state of Washington is trying to educate all our communities of colors to making sure that we get the knowledge as well as the resources. So thank you so much for this. As a person that just lost my mom with cancer, I totally understand.
Sorry.
Because when she was diagnosed with lung cancer, the doctors were asking, is she a smoker? The answer was no. So they were so clueless of how my mom has lung cancer and she wasn't a smoker. It was also shocking to me because my mom is really healthy, but for some reason she loves to clean. That was the one thing that I know of my mom. She cleans and she loves to use spray bottle cleaners. So listening to this conversation, I'm wondering to myself how many of my community that's affected by lung cancer and don't know what happened. So this is great information. Our communities perish because of lack of knowledge. And this is where I thank you, Ashley, Miss Ashley, for this. I also thank my sisters are on this Zoom. Sister Lupe Talamoni, she's one of a hard worker advocate here in Pierce County and King County.
Yes.
And then Sylvia and all our Marshall Island families and then Fijians are on the call as well as Tongan. We all migrate together for the betterness of our community,
Yes.
to making sure that we are doing our diligently job in spreading awareness with issues like this. So thank you so much for the opportunity. Sylvia, I am so humbled to be on this Zoom today because it brings a lot of education and a lot of things
Exactly.
that I can share with the communities that I serve. If there's anything, Ashley, when your comic book is ready, I
Okay.
work with youth. This will be a great
Oh,
opportunity to spread
absolutely.
awareness to some of our young kids. If we educate them young, they will grow up to be great advocates, in the community. So thank you so much. Faftai lava.
Malo, don't forget, like all the PI community leaders, please share the information. And like I said, I'm also learning from this too. And you mentioned something about like vacuum, but the rug, the furniture, all those things, like chemicals are everywhere. And then when it's build up, what is the number one chronic disease that this PFAS can create? chronic disease? Ashley?
Because there's so many there's 13,000 different PFAS, that's really something we're still learning about. I think cancer is obviously one of the most common that we're seeing tied
Like when you
to.
said cancer, it could be like a lung cancer?
Mostly from what I've heard, it tends to be uh, testicular and kidney
Kidney. Oh, wow.
and there's one
So
other.
kidney is not just the food, it's also like from chemical too, eh?
Yeah, the kidney cancers, and prostate cancer. And I don't know if that's
Prostate
because
cancer.
of the way it impacts our hormones, but it's really something that's, again, really evolving. I wouldn't be surprised if lung cancer could be caused by PFAS. It's not something I've heard about, but I've gone through something similar with my father-in-law who passed from cancer, and similar healthy, and you wonder, what can be causing these things. And it's all of these exposures that we have on a day-to-day basis, that are so complicated, and like individuals shouldn't have to be thinking about. We shouldn't have to be thinking about whether this spray that we're using to clean before our family comes over is going to cause disease in 40 years. So it's really why, our mission is to think about how we ban the use of these products, and how we get information out through folks like yourselves to make change, and put pressure on retailers and on our lawmakers to be thinking about what are we coming into contact every day? Because we can't ask folks not to clean. I love to clean too. So, yeah, I think it's really, I'm getting off on a tangent, making me emotional, but it's just so important that folks know and feel heard, and that we're demanding change at higher levels to protect families.
Ashley Bullock, thank you so much, and we do appreciate, this great wisdom and knowledge to educate us and bring awareness, of how to deal with these chemicals and prevent them. Just like, the little quote is saying, prevention is better than cure. At least we do know about it, didn't know that you cooked, like on those pots, those has chemicals, so it's safe, they use just the stainless steel, right? Yeah, not the non-stick, pan, because the non-stick pans, what is causing not the non-stick pans? The chemicals, they put the chemicals there not to, just like the foil. They put the foil, they make it so it doesn't burn when you put it in a stove, in a fire. So, but otherwise, those are converted into the food. And then we put the food in our system. And so we eat those kind of stuff. We eat those chemicals. And then our body react, and create that, issues in our health. But thank you so much, Ashley. And we do appreciate you, in our Tongan language. I'm from the islands of Tonga, the friendly islands in the South Seas, where the international line, Malo Aupito, mean thank you very much. And you do have a happy Thanksgiving. And we're looking forward to have this great topic again coming up in the beginning of the year. Because I do think that this is very, very relevant. This is a great educational topic, and it's prevention, a lot of things that we're not even aware that we're dealing with it on our everyday life. Thank you so much, Ashley Bullock, and we're about to close up, and if you have anything else to say, Voice of South Pacific greatly appreciate, the Seattle and King County Public Health for always willing, to have great topic discussion, for the safety of our community abroad.
Thank you all for having me. I really appreciate it. And as Sylvia said, we'll be coming back. But Sylvia can put you in touch with my manager as well if you're interested in any comic books and things like that. We'll be doing some more printings next year, and they'll also be available online. So we'd love to connect with you.
Thank you so much, and you have a great day. Happy Thanksgiving, and stay safe,
you
and
too.
happy Friday, happy Black Friday too. Una, do you have anything to say? The rate of check, that's your age level. Thank you all, and thank you to Lupe Talamani, and also Pastor Aseri, and Aladalo, Lowell Alik, Sina Tafunapeka. Thank you, Lasike, for representing, your Kaba people and also the Tongan community. Thank you, everyone, and happy Thanksgiving to you all.
Happy Thanksgiving to you all too.
Nia Kunawabe, thank you so much. Fautasi Tonga, Maufi Nau Moniati, and a lot of people, but I don't see all your name. Ana Fifita, Polani Tuifua, Evergreen Aunofo, thank you for joining us. Evelina, Nola Finau, Abalani Fuka, John Tawanabe, Salote Ariamotua. Thank you, Salote, for joining us. Malo opito home mayo tau kau fata. Lasike moi moi, thank you. Lord Lasike. Klepa Huamani Martinez. Kali Selu Siu. Fafetai Tui Kolovatu. Julie Tavana. Finau Frahuavea. Pio Finau, Sovea Telua. Mele Pua Topui. Elitisifa Ngungutau, Suliana Hopoi, Saya and Lile Tungafasi, Manu Pahulu, Funga Sayone, Melepo Uha Saineha Mafi, Benny Levachi, Pate Bonitau, Tau Angale Aitoa, Tino Senti, Meriani, Pangata, Selonia Le Polotina, Lolohea, Danny Estrada, Koloveteki Litea Taufa, Kuini Ohaikula, Salote Takitaki, Monse Kasia, Ti Polapiu, Akau Ola Manase, Mia Elegant, Hei Moana Kuma, Kalolaine Tayamoni, Mele Finau Fola Moetui, Ulan, Lopeti Tulikiakau, Emeline Fatu, Fislau Gaming, Israel Sopu, Pakileata, Fihaki, Fatu Pakleata, Marianne Mihai, Iva Atu, all the way to the Kiwi land. Thank you for joining us. Toine Polokalama mo ilele atoeta, Katine M. Christie, Jacqueline, Soane Watahausi, Afuitang Manakala Nivalu, Neomai Mosika, mo ilele ya pe tonga e ngai me afaka kim kare, o ku fea pe hetang mea kai. Neo mai Mosika, hange ko ngai water bottle lahi pe ai kem kare ai. Lo se hina inu ki hangana, Luciane Manu, Apple Sosa, Talapuas, Stella Hanisi, Seletete Moala, Fanguna Paia, Takai Mausa, Malo ngau lele mehena, Ofa Takai, Haiteni Ta Folo. Koya, ko tawa, umenke fausing, koya ta Polokalama. Thank you every single person that joining us today, and also Brenda Kongaika. Right in the beginning. Famalola hena mo kaumai, and please just keep sharing the great information about the chemicals. Different chemicals. It's about like the pan that you cook your food. It's about like the water bottle. It's also like about the plastic that you're using, to reheat the food, and also the clothing, the rugs, so furniture. Everything, environmental protection agencies, you can learn more, not have to consume all these chemicals and it affect the body. Ofalahiat Kamotolu, thank you so much, everyone, and happy Thanksgiving to you all. In a few minutes, we'll be starting with Togeta Pakieli.
Drop every.
O atu pene ai polkalama koini na e ngawak mai mo ana lahi ono kole mai mo ke toi tukuange. Ko ia tau whāsai fua, malo apita mo na fua e Nissan Pula.
Mai mai siva siva mai siva mai siva mai siva siva mai lue o mai lulu o lima siva mai siva mai siva siva mai lue o mai mai tamata ata mai ata mai ata mai ata mai ata mai Siva mai, siva mai, siva mai, pusi lau pangamai.